Hello, and now time for Chapter 4. Chapter 4 covers finding out what is wrong. This is where we're going to see information on a primary check and a secondary check and determining what you need to do to care for a victim. So for this chapter, upon completion, you will be able to identify and explain the steps to completing a victim assessment overview, identifying the steps for completing a scene size-up, explain the purpose of and how to complete a primary check, explain the purpose of and how to complete a secondary check, define the acronym SAMPLE, and identify the questions related to this step in the secondary check process, identify the steps to be taken when medical help arrives, and then define the term triage of how you might care for a multiple victim rescue. All right. Victim assessment overview is knowing what to do and what not to do is crucial during an emergency. A victim assessment is a sequence of actions that helps determine what is wrong. A primary check will determine if there is an illness or an injury, whether the victim is responsive or unresponsive, and if a life-threatening condition exists. Okay, this is the purpose of a primary check. Are they ill? Are they injured? Are they responsive? Are they unresponsive? Is it life-threatening or non-life-threatening? Okay. So with a victim assessment overview, you break them into categories of injured and ill. Okay. So let's say if you have an unresponsive injured victim. Okay. So you do a primary check, you do a secondary check. We'll talk about those in a little bit more, and we do a sample of a history from other people that are around you. We'll talk about that again towards the end of the chapter. Let's say they're responsive with significant COI is cause of injury. Okay, so there's a significant cause of injury. Here are your steps: a primary check, secondary check, DOTS we'll talk about, and then sample history we'll talk about. Without significant cause of injury, primary check, examine the chief complaints, and then sample, answer those questions. Let's say someone's suddenly ill. Are they unresponsive or are they responsive? And then here's the steps that you're going to take to follow for that individual. Pretty much all of them are a primary check with a secondary check. Depending on whether it's examining the chief complaint, so like the broken arm, you're not going to worry about checking their ankles and things like that if they complain of a broken arm. Okay, you know what the injury is, it's a broken arm. You might look through and make sure that there's no other injuries, but if they're saying I have a broken arm, then it's probably a broken arm. Okay. All right. So one of the very first things for this you're going to have to do is size up your scene. We talked about this briefly in Chapter 2. We want to look for hazards that might cause injury to us or to the victims. Notice the potential for violence. Be observant of weapons. Reduce exposure to potentially dangerous body substances, so putting on your gloves as you're sizing up the scene. Determine whether the problem is an injury or an illness. Those are the things that you're going to do in a scene size up. Here's a little picture. This is a scene, just a little simple image. It's kind of, so let's look through this picture and let's see what we can find that could be potential. Okay, so we see that there's a car, okay, and there's a victim in the car. I see one victim, okay. We see smoke coming from the car, probably coming from the radiator, by steam. We do see liquids coming from the car, could potentially be gas, could just be radiator fluid. We see a victim on the ground, falling off of their bicycle, and we see a car approaching the scene. So thinking about this scene, what steps would we take? Would we look at the victims and see who needs the most help? That term triage that we'll learn at the end of the chapter. So what would we do in this scene? What would you do in this scene? Okay. All right, so we sized the scene, we put on our gloves, and now we're going to do a primary check. So this is a check to identify life-threatening conditions so that you can immediately take action to treat the conditions. Responsiveness, circulation, breathing, and severe bleeding. Those are the things that we're looking for. Responsiveness, can they respond and talk to me, or are they unconscious? Circulation, do they have a pulse? Are they breathing, or do they have severe bleeding? Okay. So for a primary check, these are going to be your steps. You're going to form a first impression of the victim. Okay. Check for responsiveness. Check for breathing. Check for bleeding, and position the victim. Okay. Positioning the victim might mean that if you need to perform CPR, you're going to have them on a firm, flat surface. If they are having a heart attack, maybe you're going to sit them in a chair. If they're having difficulty breathing, maybe you're going to put them in what we call a tripod position. We're going to talk about that a little bit more in this chapter. Or let's say they're unconscious, they're breathing, and they've just passed out, and you need to put them into the recovery position. We'll talk about that a little bit more also in this chapter. Okay? All right. So for the primary check, forming a first impression, you're going to determine, are they injured or are they ill? Are they responsive or unresponsive? Are they breathing adequately? Are they talking? Are they bleeding? Is there a chance of exposure to blood or body fluids to you? Making sure you have those gloves on. If there's danger to you, the victim, or any bystanders that are around you, do you need to move that person, or can you move that person? Do they have a spinal injury or something of that nature? Okay. You're also going to check for responsiveness. If the victim is motionless, gently tap the victim's shoulder and ask loudly, "Are you okay?" Okay. If they don't respond, then you're going to shout louder, and then if they still don't respond, then you're going to assume that they are an unresponsive victim. Okay. There, right here is this little AVPU scale. Okay. This is the way you can determine what a victim looks like. Are they alert? Are they responsive to verbal stimulus? Are they responsive only to painful stimulus? Are they unresponsive to any stimulus? Okay, so responsive, these three are responsive. Unresponsive is this one here on the bottom. Okay, if you have an unresponsive victim who's not responding and they're an adult, just an FYI, you're going to begin CPR on that individual. Because what we've found is that in most individuals who are unresponsive, that you find lying on the ground, there's a very good chance they've had some kind of a cardiac emergency, and we need to begin CPR immediately on them. We'll talk about that more when we get into chapters 5 and 6. All right, checking for responsiveness. Here's a little bit more. For an alert victim, responsiveness, call 911 if needed. Position the victim in a comfortable position. Check their airway, check their breathing, and check for circulation or bleeding. For an unresponsive victim, they're responsive. Activate EMS. If they're unresponsive, you're going to activate EMS. Position them on their back or a firm surface. Begin CPR. Check the airway, meaning you give them 2 rescue breaths after you give 30 compressions. We'll talk about that more in chapter 5. And breaths. Did the breaths go in? Okay? All right. So that's alert victim and unresponsive victim. So here's some unresponsive victims. So here they go. She comes in. She says, "Are you okay? Are you okay? Can you hear me?" There's no response. She says, "Call 911," and then she begins CPR. Okay? Compressions, and then she's going to position him to give 2 rescue breaths. All right, so positioning the victim. Most victims should not be moved except in worst case scenarios. Okay? Exceptions would be an unsafe location, victim is face down and needs CPR, victim has difficulty breathing from vomit or secretions, first aider is alone and must leave to get help. Okay? The best position to put an individual who is lying down is on their left side. This allows for better digestion. It also prevents them from aspirating any vomit if they begin to throw up. So that left side position is important. Tripod position is a good sitting up position for an individual who's conscious. That's basically sitting with your hands or your elbows on your knees in a tripod position, and it helps provide good airflow and help them get good breaths. Okay, so here's a little bit image of those two. So there's the left side, keeps the airway open, delays vomiting, delays the poison's effects, relieves pressure on pregnant woman's vena cava. Okay, the tripod position is just a better position to give good breathing. Okay, so checking for breathing, look and see if the chest is moving. Are they have normal or abnormal breathing sounds? Are you hearing gurgling? Are you hearing coughing? Are you hearing wheezing? Are you hearing gasping? Feeling for adequate air movement. You can also put your hand to their nose. Do you feel air coming out of their nose? Here's some breathing sounds and some things that they might be able to tell you about the breathing sounds, or the sounds that you hear coming from someone. Check for severe bleeding. Check for the large amounts of blood. Are there large pools of blood around the victim? Are there large pools of blood on the victim's clothing? You want to make sure that you can control that bleeding, and then make sure that you're wearing exam gloves whenever you're taking this step. All right, so we've performed a primary check, and now we've determined what's wrong with the individual. Okay, we've determined if they're responsive or unresponsive. We've determined whether it's life-threatening or non-life-threatening, and we've positioned the victim. For a secondary check, that's to determine whether the cause of the injury, the mechanism of the injury, was significant. If there's no significant cause of injury, there is no need for this type of check. Instead, focus on the chief complaints. Okay, so a secondary check is only going to be done if there's no chief complaint and the victim still complains of injury. Okay, so if they tell you my arm is broken, then you're going to care for the injured arm. But if they just continue to tell, they can't tell you anything, or they're just complaining of just not feeling well, then a secondary check is probably a good thing to do. Assume a victim with a head injury also has a spinal injury. You cannot provide care to a victim until you know what is wrong. You cannot know what is wrong until you do an assessment. So if you don't know what's wrong, a secondary check is required. So for a secondary check, you're going to look for signs and symptoms. Okay, signs might be what can you see, what can you feel, what can you hear, what can you smell. Symptoms are going to be things the victim feels, things the victim can describe, or then chief complaints that victim might have. Remember, if they're unconscious, you're doing CPR. Okay, if they're conscious, then this is a secondary check. So for a secondary check, you're going to look for what we call DOTS: deformity, open wounds, tenderness, and swelling. To check the part of the body, look and feel for the following signs and symptoms. Is it deformed? Are there abnormal shape to the body part? Okay, there you go. Dislocated elbow. Are there open wounds? The skin is broken or bleeding. Is there tenderness? Okay, does the person have sensitivity or discomfort whenever you touch a part of their body? And is there swelling? Does it look larger than usual? Compare a body part to the same body part. Okay, so you can kind of see if there's swelling in there. Okay. Does the victim show signs of significant cause of injury? This is a hands-on, full-body, head-to-toe assessment. Should take no more than 2 minutes to complete. We're going to go through and I'm going to show you those steps now. Okay, so for a secondary check, check the head, check the scalp for deformity, open wounds, tenderness, and swelling. Do not move the victim's head during the procedure. Check the skin for temperature, color, moisture. Check the eyes for pupils. Are they equal? Are they round? Do they react to light? Do they react to your hand movements? Check the ear and nose for clear blood-tinged fluid. Check the nose. Does the nose have deformity? Does it have an open wound? Is it tender? Is it swollen? Check the mouth for swelling or objects, broken teeth or dentures, chewing gum, vomit, or any foreign object that might be blocking the airway. Now you're going to check the neck. Same thing, deformity, open wound, tenderness, and swelling. Look for a medical ID. You could also find these. You might also find these on the wrist that might tell you whether the victim needs medications. You're going to check the chest for the same thing. Be sure to let the victim know when you're going to apply pressure to the side of the chest. If they happen to have a rib fracture, it's probably going to hurt pretty bad. You're also going to check the abdomen for the same thing, deformity, open wounds, tenderness, and swelling. Feel for the tenderness on all 4 sides of the abdominal quadrant. Okay, so basically you're going to split the abdominals into 4 quadrants. Okay, so 1, 2, 3, and 4. If the victim reports any pain, have them point to where it hurts. Check the pelvis for the same thing. Press inward on the tops of the hips and bones, and then press down. Okay, make sure you tell the victim before you do this, and have them point to if they have pain in a significant area. You're also going to check their extremities for the same thing, hands and legs. For both hands, encircle an extremity and gently firmly squeeze each part of the extremity for tenderness. During this check, you might also check for what we call CSM, circulation, pulse, sensation. It's a pinch of the fingers. Can they feel it if you pinch their fingers or their toes? And then movement. Can they wiggle their fingers or toes? If they can wiggle their fingers or toes, it doesn't always indicate that there's no broken bone. Sometimes they can still wiggle their fingers and toes even if they do have a broken bone. But the fact that they can wiggle those fingers means that there's no nerve damage or muscle damage, severe muscle damage. Check the back if the victim has no spinal injury. Roll them over onto their back and check for the same thing on their back. All right, some special considerations when doing a secondary check. You want to look at their skin color, check their skin temperature. Is it moist? Does their skin look ashy or pale or blue or yellow? Are they real flushed? Are they red? Is their skin warm and dry? Is it hot and dry and moist? Is it cool and moist? Are they hot, like they have a fever? Okay. Another thing that you can also do is what we call a capillary refill test. This is just going to tell you whether the individual has good circulation to their fingers. So you can actually do this on yourself now. If you're not wearing any fingernail polish, you can press your fingernail or toenail for a few seconds and release it. Okay. When released, the blanched skin would return to its normal color within 2 seconds. So if you pinch your finger, it's going to turn white, and as long as it comes back to its normal color pretty quickly, then you're okay. But if it takes longer than 2 seconds for that to turn back to a good pink color, then it probably is an indication of poor circulation. Some other special consideration expose the injury. So if an individual has a wound or you need a splint an injury, you need to make sure that the clothing needs to be removed to examine the injury. If this needs to be done, explain to the victim what you're going to be doing, and then make sure that you think to maintain their privacy. Thinking about with the AED, we'll talk about this. If you need to use an AED, it has to have skin to pad contact. So that means you have to remove that individual's shirt to do this. So if you have a woman, thinking about modesty and who all's around. Okay, and then medical identification tags. Do does that individual have a medical alert tag that tells you that they need to take medications? If you see those medications, you might want to look for those medications in their pockets or in their purse so that they can get that medication that can help save them. All right. So what do you do now that you're caring for the individual and you're waiting for EMS to get there? So let's say you have an individual, you're performing CPR. Your CPR is a special case. You're going to continue CPR until someone relieves you. But let's say you just have an ill individual and you're just waiting on EMS. So you're going to recheck them for serious illness or injury every 15 minutes and stay with them until EMS arrives. Let's say you have an unresponsive victim. You want to check them at least every 5 minutes. If you have an unresponsive victim, you're probably going to be performing CPR and you're going to be continuing that until EMS gets there. All right, and the last one is that term triage that we talked about. The process of prioritizing multiple victims, immediate care, breathing issues, severe bleeding, severe burns, signs of shock, open chest or abdominal injuries. Those are going to be the people that you're going to care for first. Delayed care is what we're going to call the walking wounded. Those are going to be individuals that you're going to care for, and their care could be delayed for up to an hour. An individual who doesn't have severe bleeding or just has a broken bone or some bruises, things like that, they can wait a little while to be cared for, but you need to care for those people who have immediate care needs first. And then, unfortunately, individuals who have passed away or who are unlikely to survive, those are going to be your last ones you're going to care for in a situation where you have that going on. Provide care to the most severe victims only until more help arrives, and you are free to move to victims who need less care or on to victims with severe injuries. Okay, so that's that term triage, just the prioritizing of multiple victims. All right, so that's the end of chapter 4. If you don't have any questions, you can send me those. You can call me. You can send me those in an email, and I'll be more than happy to answer those. Don't forget to take your quiz, and I hope you have a great rest of the week.